Welcome everyone. This is our weekly residence meeting where we talk about cases. And I turn it over to the residents. Today we have Amber.
Hello.
And Amber's, I don't know what she's going to ask yet, so we'll find out. What's your question?
My question is, we treat a lot of fatigue, anxiety, and depression. We like to call this FAD or FAD. It's probably the most common thing we see. So my question is, how do we address this acupuncturally?
Okay. First of all, I would strongly recommend, because we're a clinic that practices acupuncture and herbs, FAD we treat in this clinic with herbs. We can do it with acupuncture, and I won't avoid the question, but it takes a long time, and it's sort of unethical because you would spend a fortune treating it. You'd spend 8-10 months treating it. You'll get a better result with the herbs. Now, for those of you who have practiced my pulse diagnosis or Dr. Cheng's pulse diagnosis, you will find that in almost all cases, people with this FAD have a particular pulse. It's too deep. The pulse is way too deep, which means blood stasis and fluid stasis in the body. And they invariably have a heart problem, where the heart is sluggish, or there's a murmur. The heart pulse will be scattered or deep and weak, which means there's already fluid building up in their chest. So all you have to do to get them to snap out of it is to raise the pulse up in all positions, because it's deep everywhere. The most effective way to do that is to strongly move the blood. And for that, we resort to a combination of herbs from my buddy back 300 years ago. Forgot his name. I should know it. My blood brother. Anyway, he discovered the same thing. Zhui fu zhu yu tong, gaja zhu yu tong, shao fu zhu yu tong, and throw in a little leech, shui zhi, maybe 10%. Put that in the formula, and give about that formula altogether, give about 80% of your herbal formula should be those guys. The other 20% you need to treat the heart if the heart's weak. If the heart pulse is weak, then you can put in Feng, Ji, Huang, Qi, Tong, about 20%, and give that to the patient. And you will find in 1 week that pulse will already come up. The Guan pulses will already be in their proper home, which is in the middle. The heart pulse will come up, but it won't be fixed yet. And the Chur pulse will come off the bone and be in its right home. So you've already fixed 2 out of the 3 positions, and that's in 1 week. You continue until the pulses are normal. If the patient comes to you and they have fatigue, anxiety, and depression, and you feel the pulse, and the pulse is too deep, it could be that the pulse is deep and kind of pounding. It can happen. And the heart pulse is also deep and scattered. That is not a weak heart, because the rest of the pulse is pounding. If the heart's really weak, if the pump's weak, the whole pulse will feel kind of weak. It's just mechanical. If the pump is weak, all the circulation will be weak. But if all those other pulses are strong, they're too deep, but they're strong, do not strengthen the heart. What you have to do is usually just ignore the heart entirely